first question is for me to understand a little bit better about the folks that are on the session today and where you feel you are in your career journey. So we'll give everybody a couple of minutes to feed into that. If you haven't introduced yourself in the chat yet, please do. It's always fantastic to learn more about people, but also for everybody else to find out a bit more about you as well. So that's an interesting spread we've got there. So we've got some people at sort of earlier stages of their career looking at moving on from first roles and looking to see potentially where to go next in terms of career development. So hopefully there'll be some useful info on this session to you. And those in that maturing stage of your career. That's fantastic. Thank you for sharing that. That's an interesting wave. I'm just wondering if we have insights into the gaps in resourcing and skills that we might need to develop around that. But that's great. Thank you for that. And then, so the next question looks at what is your current role type? And it's not necessarily a job description, but kind of what kind of role are you in? So we do have quite a lot of sort of people who have project or change management as an add-on to a primary profession in another field. So if this isn't your primary profession, but you've just come to hear more, if you select the first option, which is an add-on skill to another profession. But for others, if you're looking at, we've got project support roles or PMO support roles, project support officers, project managers, program managers, change managers, anybody in a PMO. We've got portfolio office, SRO and leaders, anybody who is involved in workforce development, because I don't know whether there might be people here that were joining this to find out more from that perspective. And then we've got one that's the other. If you're feeling bold and confident, the person who's put other, if you want to put something in the chat to let me know what that is, that'd be useful to know. So we've got a little bit of a spread, but primarily in project support, program and project management, a little bit of PMO, a little bit of portfolio office, one change manager, one in SRO leadership role, and a couple in the other role. Again, an interesting split. Traditionally, we've got people who have associated more with project and program roles because they're much more well understood by the rest of the organisation and potentially the recruiting managers, slightly less so on the change management side, but I think there's a real gap. So that's why we focus quite a bit on that. So that's really interesting to see what that spread is, and that's good. We've got quite a few different areas of the profession represented there. Given everything that's going on, the other thing that I wanted to have a think about was what's your feeling about your career in healthcare? And it might be in terms of context now, might be in terms of where your role is, might be in terms of direction of travel, but it's just useful to get a bit of a pulse of what's the feelings and thinking about your careers right now. How do you feel about it? Do you feel we've got a good start there? Secure, rewarding, and frustrating. I imagine that's potentially all in one day sometimes. So varied, exciting. So we've got some positive things. Changeable, yes, I imagine. There's a bit of there's some uncertainty in there. Chugging along, yes. Yeah, sometimes that's part of it as well. Happy, good. It's nice to see that there are some positive feelings and perceptions around it at the moment, because there is a lot of destabilizing activity going on. So it's good to know that people are feeling that there is some positivity. But in terms of slightly more focus words, we've got frustrating, uncertain, and changeable in terms of some of the negative. Some people a bit anxious. Pride. Thank you, whoever put pride in. That's lovely to hear that there's pride in the profession. We've got very less progression, and maybe that's something that we can look at is where's the career pathway and needing a clearer path, no promotion. I think these are some of the challenges, definitely. Disrespected. That's interesting. Interesting to know disrespected by whom. One of the things about setting up the association and creating the framework for the profession was to create a level where we stand amongst our peers, both clinical and non-clinical. And I think there's more of a journey to go on in that space. And part of that is how we develop this professionalization. I'm going to talk a little bit more about that, but hopefully that bit about clearer pathway and not feeling maybe valued or respected as a project and change professional is an area we really need to work on. Part of the reason I do a lot of work with the other non-clinical professions as a starting point is I think part of the thing is about them understanding what it is that we do and how we add value. We might know, but actually we need to share that with everybody else and let them know. I'm also doing some work with some clinical associations as well, because again, getting clinicians to understand the value that we add is very important. Thank you for sharing those thoughts and feelings on that. I think that's really important to understand the breadth of that at the moment. In terms of then, what are the biggest challenges to career progression? It would be useful to understand that and what people's experiences are in that space. So what challenges? Funding for training. Yeah, I suspect. There's also an opportunity to upvote. So if you agree with any of the ones that have been included in here, do tick them, because that lets me know how many people see the same challenges as well. Lack of visibility of project delivery careers, yes. Small teams, therefore not lots of movement. Yeah, there's some interesting ones here, and I suspect many people will recognise this in their own organisation, their own experience. Too much banding issues, unable to jump from 8B to 8C from band 7, even after having yes. Availability of the roles is a challenge, and I think we're going to find that that becomes more so with the reductions in the non-clinical workforce because of the cuts that are happening. Budget restrictions resulting in fewer jobs, yet limited opportunities. Recognition of the profession and correct banding, yes. I think there's something about the equivalence to other professions there. Position of ICBs, that's something we're going to have to wait on to see what comes out around the role of the ICBs and then what the profession can do within that. Small project teams, accepting PMO and change management, yes. And I think this is partly a lack of understanding in some of these other professions around who we are and what we do. Inconsistent job descriptions, understanding role requirements at organisational level, yes. There's a couple of things there that really around the organisation, because you can do as much as you can as an individual looking at your own professional development and career development. But if the organisation doesn't have a framework in place to support you with, career pathway, opportunities for advancement and progression, it's not going to actually make the environment better from a career progression point of view. This is one of the things that I want to talk a little bit about in terms of what's the organisation's role in this, but also how can you advocate for the profession within the organisation. Lack of cohesive PMO, structured peer learning, good practice, etc., etc. Yeah, we've got some stuff that we can look at in terms of standards for consistency's sake, which is, I think, one of the underpinning issues. Annual planning can't go beyond 18 months. Yes, that's a perpetual problem that's not been cracked in the last 75 years. I don't think we're going to crack that one anytime soon, unfortunately. But we can plan for a longer future. Lack of core skill set, huge variation in different parts of the NHS. Yes, absolutely. Finding the right role, lack of opportunities. People choose internal candidates for promotion. Yeah, favouritism, mentorship or lack of. There's some things around that we can support with a little bit. People choose internal candidates. Sorry, I read that one. Lack of project capability underpinning delivery of organisational change. Absolutely, yes. And if anybody's been through any of the reorganisations in their career, they'll know that they're often quite badly done from a human perspective. It's all about reshuffling the org chart. and yet there never seems to be any real learning and improving how they go about organizational change. That's always a bit frustrating. Disparity between boards, yes, in different. So Scotland, Wales, and Northern Ireland have health boards rather than the ICBs that we have in England. And again, there's inconsistency across them because there isn't a standard framework across the patch. Breaking from admin to projects, yes, I think there's always a challenge around that and support around that. We often get under-resourced roles in terms of there's a natural affinity, I think, if you're good and organised between being a good administrator and being a good project manager, because it takes structure and and you can learn the project management on top of it. What tends to happen is we get very senior subject matter experts leading projects, and then lower level project managers who then struggle to get sort of role well in charge of that project, and not just the subject matter experts running it. Lack of leadership pipeline for PMO teams, yes. And we'll talk about this because I think that one of the big challenges is this career progression piece, and how can we build that outside of the individual organisation, because somebody mentioned about small teams. They are, and it's very disaggregated. We'll talk a little bit more about that, but thank you. There's some really useful stuff. What we'll do is we'll collate this information and share it and look at what we can signpost people to do, or things that we have that can support with that. But it helps us to understand where the challenges are and what we can do about them. Okay, fantastic. Thank you for sharing all that. Give me a template in inverted commas. Is that what you're seen as being there to do? Not seen as being a professional like the others, yes. And that's something I think we all need to support with. Ability to find investment, support career progression, evolving new roles within NHS, which are new shiny roles, but duties are overlapping to other professional roles impacts. One of the things that there is a Venn diagram crossover between professions. So if you are, say, in the digital data and technology profession, there is an overlap in areas with project and change management. What I'm doing is working with the other associations on where those intersections are to see what have we got in our career framework, what have we got in theirs, but also what do we do in that crossover space between associations, which is why we've got these events coming up with Fed IP to say, actually, we all have a collective role to play in delivering some of these things. Let's have a look at how we can come together to improve how we do it and share some of the learning and cross-fertilise those skills across the professional boundaries. Okay, so I think this is the last question, and it's really about what would be most useful for you, because again, this will help us to focus on the priorities for what will help you as members of the community to support your career development. So if you can tell us what will be most useful to you to help that career progression, that would be very useful. Give you a couple of minutes to think about that. So methodologies, and that's understanding the different ones. We do have something on that, and we will be doing more on that going forward, because I think there's something about people generally only learning one, depending on the kind of project they're in. But actually, methodologies are tools, and as a project manager, you want as many tools in your tool bag as possible. That gives you the flexibility to work on different kinds of projects, and it's using the right tool for the right job. Understanding the different options for roles in the career path, we're going to talk about that. Something around job evaluation to have consistency. That's a tricky one, because NHS employers has the role profiles which are generic, and we can't adapt those, unfortunately. But there's something around what a requirement for a role might be that you can put in a job description that makes it consistent. Signposting to training opportunities, develop staff. There's lots we can do in that space. We'll talk a little bit about that. How to show capability and expertise in changing a change PMO without having already worked in that organisational change type. I think that's about capabilities. There's often a sense that if you haven't done this specific topic or this particular operational area of the NHS, then you can't understand how it works. I don't agree with that. I've done lots of projects on lots of different topics, and I wasn't experts in those areas. They were. That was the point, the subject matter expert. My job was to come in and manage the project around it. Now, I learned a lot about those topics on the way, but I wasn't the one that needed to be a subject matter expert. The project and change skills were the things that actually they needed in addition to their subject expertise. Thank you, Rachel. She's with me on that one. So I think it's about framing what's the specialist skill set you're bringing to that environment that they don't have. How the same role looks across different organisations. Yeah, some of this is about consistency. We talk about standards next, really, and where they come from and how that applies to us. Qualifications, career pathways, best practice used in healthcare, different roles available and skills attributed to them. Yes, we can cover a little bit about that. Progression to director level from program manager role. This is an interesting challenge because there aren't that many program or project director roles because there are often not that many big but frequent enough project management senior roles at director level. And that's something I think we need to look at because there's a real gap there. And I think there's a real gap then in terms of board, because boards don't often have somebody who represents the investment portfolio programs projects across the organisation, which means that they don't get that professional insight at that level. That's a bit of a challenge, I think. Tools to be able to implement changes, see what careers are open to me. Tools, methods, templates, core skills, sports. Yep, just roles, progression, pathways. We'll talk about that. Senior leadership roles, tools for PMOs, developing plan to project management, skills on offer, okay, apprenticeship opportunities. Oh, that's a good one. Thank you for dropping that one in. Yes, we do have apprenticeship opportunities, and with budget cuts and training cuts, that's an option that might be worth looking into. Progression project support to manager. Okay, culture shift. Yeah, interesting one. Thank you. That's more around the change management side of things. So there does need to be a culture shift in order to enable some of this stuff to be implemented, and there needs to be advocates and champions for it in the space. So just very lastly, it's been hugely valuable getting your insights into this. Where would you like to see the profession in 5 years' time? Because that's the thing that we're going to be working on, and collectively with all the volunteers and across the different regions and countries. So what would you like to see the profession being in 5 years' time so that would really add value to you? Respected. That's a great place to start. Thank you. Yep, recognised. Collaborative. Yep. More closely aligned. Yeah. Recognition of value added. Yes. Highly regarded, cohesive. Making demonstrated sustained change. Absolutely. Greater career mobility. Yeah. Well respect and utilise knowledge of project professionals for wider community. Understood career pathways. Understand our importance. Yeah. More centralised rather than separate project roles across different teams. That's an interesting one. Not a lot of organisations have a central portfolio office which has responsibility for setting the standards, the competencies, the career frameworks. A lot of organisations have evolved PMOs in different parts of the organisation. So you'll often find that there is a transformation PMO, QI PMO, a digital and data PMO, estates and facilities PMO. But often they have evolved separately from each other and not necessarily have a cohesive whole, and therefore the oversight of the investment in those changes isn't really visible, but also there isn't that setting of standards and competencies. And this is why I advocate for having a corporate portfolio office because that can set those standards and build that consistency and connect up those different functions as well, that allows people to be able to move around potentially a bit more. Evidence we are actually effective. Yep, evidence is probably a good one that we need to provide to people. Bridge between different organisations and systems, absolutely. Yes, we have a critical role to play around that. Opportunities for career development, diverse, inclusive and cross-sector, absolutely. PMO should be central to which many trusts don't have. Exactly, that's the point. Okay, fantastic, thank you so much. And if you think of any more, I'm going to leave that open, so keep adding them in as you think about them, because what we'll do is we'll take those away. What I want to do very briefly is talk a little bit, and we'll have a Q&A at the end. So if you've got questions or you would like to ask a specific question, you can either use the Q&A or we'll put hands up at the end so you can ask your question out loud. It's always really nice to hear people's voices and stories. So please do ask questions. Just a little bit about understanding what the underpinnings for the profession are, because not everybody might be familiar with this. So very briefly, the Association for Project Management is the primary chartered professional body in the UK. There is also the Project Management Institute, but that's not a chartered professional body, and it tends to focus more on private sector development. So it's global, came out of America. Each country's got a chapter around the PMI. They basically do the same thing, and they're now working closely together on things. But in terms of becoming a chartered project professional, the APM is the route into that. We have corporate membership of that. So if your organisation is a member of us, you can access that and join that and get some of the benefits as being part of a corporate affiliate membership. From a change management point of view, the Change Management Institute is one of two associations that set standards, and this was developed by colleagues who've helped us develop our capability framework, ensuring that change management standards are built in. Their model's slightly different. They have foundation, foundation practitioner and master levels in terms of change management professional standards. But how that works in the public sector is that what used to be the Infrastructure and Projects Authority, which you might have heard me talk about in other sessions, they have now been merged with another infrastructure body and moved from Cabinet Office, where they were based, to Treasury. That happened on the 1st of April. And the new function is called the National Infrastructure and Service Transformation Authority, or NISTA, as they're known for short, which to me sounds like a Bond villain's lair, if I'm honest. You know, join the NISTA group. But so the Infrastructure and Projects Authority, they have oversight of all the major projects in the public sector, including healthcare, and there's about 10 projects in major projects in healthcare at the moment, including things like the New Hospitals Programme. There's also some big IT and infrastructure projects. But they also set the standards for the project profession in the public sector. Their development of it primarily focuses on civil servants. So if anybody's going to be affected by the abolition of NHS England and potentially might end up in the civil service by working for DHSC, that might be of interest. And we can talk about that another day for anybody who's directly impacted by that. But what they do is they set the standards, and what we've done is we've adapted the standards they set for the civil service and made them relevant to the NHS. Now, if anybody's from a non-NHS organisation, social care, voluntary community sector as part of the group, we haven't done the adaptation for those yet. Social care doesn't tend to have a consistent framework in place that we know of. So that's something we will be looking at in future. So we've adapted it primarily for the NHS at this point, and it aligns to Agenda for Change. So even if you're in whichever country you're in, the Agenda for Change framework should still apply. So this sets standards and consistency around the profession across the public sector as a whole, because the standards for the NHS now align to the government standards. And what we've done is we've adapted and used a public sector model for the development of the profession and used it as a model for developing the project and change profession. I'll talk a little bit about the particular elements, but the underpinning thing is career pathways and job families. So that organisational development bit, competency frameworks and toolkits, learning and development curriculum, and training and development opportunities, which includes apprenticeships, diversity and inclusion. So looking at the data and analysing that, we've mentioned around that, and we've got that ED&I group. That links then to talent management. We do have a link to the NHS England talent time banking offer. So we'll give you the links to that if you're interested. How that's going to continue with the abolition of NHS England, we don't know yet. But what we will do is anybody who is interested in talent management, if you get in touch, we will signpost you to somebody, or we can help you to find some advice and support that will help you with your career development. And then the two key things that make a real difference across the landscape are workforce planning. And this was an area we were developing and hoping to get in place, because part of it's about understanding where the profession is, where they're at, what the skills gaps is, what the opportunities are, and that will help with things like workforce planning, resourcing. So the resourcing bit is then about where are their opportunities, where are their career, job roles, where are their opportunities to progress, and that's a whole area we were looking to develop. And it's one that's in progress, but might have to go on hold whilst the whole infrastructure of the NHS gets sorted out. But as a starting point, looking at consistent roles and job families, the competency framework looks at the government framework for the civil service and adapts it for the NHS. Now, the thing about this framework is it includes not just those with a professional career development. So if you're wanting to progress as a project and change professional, the bottom third of it also covers non-project and change professionals, because let's be honest, everybody gets involved in projects, whether they're clinicians or finance or ops. Everybody has a role to play, and therefore what we need to do is make sure that they are competent to the level they need to be at, in addition to their primary professional field. So we have some core skills training available for everybody to do, but also if we can build that skill set for those people and say, it's a bit like being a first aider. Having no training in first aid doesn't help to deal with the problem at that time. Having first aid training gives you enough to be able to deal with that situation at that point. But as part of that training, you're very clearly meant to understand that there is a limit to what you can do, and beyond that, you must refer that person to a professional. And that's what we want everybody else to understand is, yes, you can develop project management first aid level skills, but you need to then pass it on to somebody who has more professional skills to lead more complex programs and projects. At the moment, there is a little bit of the, I think, the Dunning-Kruger effect, where people who don't know anything about project management think it's easy and therefore will give it a good go, despite the consequences. So getting everybody to understand the basics is a really great starting point. So you can recommend that online learning to your peers in other professions in your organisation, because they're free for everybody to do on e-learning for healthcare. That link has just gone in the chat, so do click on that and then send that to your colleagues to say, oh, by the way, this is free. The other thing is that underpinning it, we've got 9 core competencies plus 3 specialist competencies that look at portfolio management, program management, and organisational change management. Those aren't in the government framework, and they're not in the APM framework either, because the APM and government really just focuses on project management. So those are things within the framework that are of value. The other thing in terms of career development is the government has looked at, beyond the role and the competencies, is the skills level as a whole. So skills level is not just, well, I've been on this course and I've got this job. It's about what experience you have, what projects you've delivered, and being able to evidence that. So the government framework, and our framework has been aligned to it, is they are accrediting people at skills levels. So you can be foundation practitioner, senior practitioner, and master practitioner level. And those align to the International Project Management Association standards, and those are global standards. So if you're looking to develop from a career point of view, there's a couple of routes. You can look at to go through the skills level assessment, and that's an area we're going to be developing and giving people an opportunity to apply for that. Because that's not just about what qualifications, it's an experiential assessment that says, and what experience have you got in delivering this? That also ties in with the APM's chartership route. And for those that are interested in that, the events that we've got coming up with the APM, that will talk more about that. Government aligns those two things. So as part of, say, practitioner or senior practitioner level, the APM chartership would give you an accreditation level at that level to say, yes, you've been assessed as meeting those competencies. Moving on from the frameworks, and say, if we can get those frameworks consistently across organisations in terms of here are the roles, here's the competencies, here's the skills level, here's the assessment of them, and we've got a competence assessment tool to go with that, that's a starting point for getting that consistency across the landscape. Alongside that competence assessment tool, which then looks at what are the elements you might want to develop individually, there might be areas around benefits management or risks or some other core competency that you might want to develop. There's then training and development support that could help have those conversations from a professional development or your appraisal point of view to say, this is the bit I want to have support with. Now, we do have a guide, the Learning and Training Prospectus, which looks at the roles and the skills and makes some recommendations. Now, we're not here to tell anybody exactly what they should do. Everybody's role and kind of route is their own, but there are some recommendations about what could be useful in terms of that particular role and that particular career pathway. Alongside that, and this is where I think, given the financial constraints that every organisation is under, a lot of people have been told there's no budget for training, there's no money for conferences or travel, and a lot of that is being shut down. That being the case, apprenticeships are a really good alternative option because the organisation has still got to pay its levy whether or not. So if you can get in there, and I'll show you a little bit about the apprenticeships in a moment, but the apprenticeships would give you that alternative both for you and your team. So do have a look at the apprenticeships that are available and the guides. They can also be accredited towards chartership. So if you've done, say, a level 4 project management apprenticeship and a level 6, that leads into becoming chartered. So it gives you all of that experiential learning because you're applying the learning on the job that you can then use as part of your application. So you've got the Academy, which has the online learning. We've got the self-assessment tool. We've got the apprenticeship guides and also the prospectus to help with some of that standardisation. So somebody's just put a question in. Sorry, just joined the meeting. Can I ask if you're advocating for any particular level of professional qualification for project and program managers? So there are recommended levels of qualifications, but I just think about Prince 2 and MSP are methodologies. So those are tools. If you're looking at professional qualifications as a project manager, you might look at, say, the APM training. So there's the APM fundamentals, the APM project management, project qualification, and the project professional qualifications as professional qualifications. And often we get those kind of mixed up with the methodologies, but Prince 2 and MSP don't teach you how to be a project or a program manager. Those are tools for doing those particular kinds of activities. As a change manager, the the Change Management Institute training, that does, so foundation, practitioner and master practitioner level, those do teach you how to be change managers. And then you've got methodologies that then support you with that, so tools to do the job. So then very briefly looking at then the ED&I, stop sharing for now. We've just got a couple of slides in terms of what resources are available, but do ask your questions now. Stick your hand up if you're happy to shout out your question. If not, stick it in the Q&A. Samsa's questions, I understand Prince 2 comes across in most job requirements. I have been trying to kill that for years. If you see that, or if you're writing a job description, please don't put Prince 2 in it. It's a methodology, and one that isn't really appropriate for a lot of projects in the NHS. It's very good if you're building an aircraft carrier over 15 years. If you're not, it's not necessarily the most appropriate methodology. If you're looking at training, what you're looking at is, so he's mentioned PMP. So PMP is the Project Management Institute equivalent of the APM qualifications. That's absolutely fine, Samson. What should be in those job descriptions is a level of qualification or equivalent. So it shouldn't necessarily be a named one, but say or equivalent level of professional qualification, of which PMP is perfectly up there with the APM ones. So yeah, they should be used. Can I stay online after the meeting to arrange another time to discuss? Yeah, let's do that, Lynn. We'll sort that out. Just a thought on Prince 2. It feels like a default hangover in, oh, it is. I mean, it's like a cockroach. I can't kill it. And it's not that it's bad. It's good for what it needs to do, but it's not the only methodology around that. And as you say, it's been around from the 1970s, from big builds. APM isn't a methodology, it's a body of knowledge, but the difference there is it teaches you how to be a project manager. And then you pick and choose the right tool for the job. So it might be that you use agile iterative product development if you're doing an IT project. You might use QSA or another quality improvement methodology for a quality improvement project. You might use MSP for managing a new hospital build. So it's the right tool for the job, but it doesn't teach you to be the plumber. So if you think about what's the core underpinning skills as a project manager, and then think about what's the right tool for the job, the different methodologies can give you the right tool to help to fix that particular problem. So have a look at the APM qualifications if you're in one of those project management roles. Look at the Change Management Institute if you're interested in the change management roles. But also, if you wanted to recommend training to colleagues, do put them in or signpost them to the online learning we've got. We also have SRO training because they're often very much not project professionals. They're often subject matter experts, and it's really helpful to give them that opportunity to develop that learning. So let's have a quick look at any questions in the Q&A. Anybody feeling brave and want to shout out a question? Stick your hand up. So Rachel's put, what would be your strongest argument to employers to take up professional project and change membership? The strongest argument for me is it's about some of the critical things that are going on at the moment. So it's about financial efficiency savings. Finance is talking about what the financial position should be, but they're not going to be the ones delivering it. The improvements, the projects, the changes, the ways of working, all of that needs to be project and change managers. We can all play a critical role in helping the organisation to implement those changes effectively and sustainably. I suspect a lot of us will have seen some very well-intentioned projects and change unintentionally cause a crisis somewhere else, or not to deliver the changes that were intended, and therefore the value isn't achieved. This is our subject specialism. Please make that kind of clear to your colleagues and work collaboratively with them around it. They don't necessarily know what we do. I'm doing my best with the other associations, but make relationships, build relationships with your colleagues, your finance colleagues. If you think about finance and the financial challenges at the moment, can you work with them around things like benefits management, ROI, how you build those in, how you manage them, who's delivering them? There's also things around, say, organisational change and change management. We've got some great stuff on understanding neuroscience for leading change, because actually knowing what goes on in people's heads when they're presented with change is really important. So building those skills and using what's available for yourselves in terms of your career progression, but also advocating for your organisation to have membership, because there's a lot of valuable resources in there around standards, best practice, career frameworks, toolkits, and all of that can help the organisation with its maturity. We also have the maturity assessment in the membership as well. Individuals might get better, but if the organisation doesn't mature, it's not going to sustainably deliver those changes. We've got some evidence, particularly around change management, that might be useful. Rachel will look to send a link out to everybody that says, why does it add value in terms of sustainable improvements in the long run? That's given you some helpful use and understanding in terms of both yourself and what's available to support you. Going beyond the kind of core skills training, we do our own, but we don't necessarily get to accredited qualification level because we're doing the stepping stones to help to take people to that level. So we're not competing with the APM or CMI or others in that space. But there are some valuable ones that might be available to people. And again, I know budgets are a constraint at the moment, but actually, if your organizations are going through change and you need to improve financially, productivity, mergers, working collaboratively, building your not project and change skills are going to be the critical things that are going to help you to do that. We have some essential series of courses that we have developed, which takes sort of level 2, project management, benefits management, change management, risk management, and the SRO essentials. So those are available if people are interested. Have a look at the website to find out more about those. The SRO training, again, very important if we're going to deliver sustainable outcomes, that the people leading them have the knowledge and skills around that. And then membership was mentioned. Oh, that's disappeared off. As I say, we are a not-for-profit community interest company. We only exist because we get organisational membership or training that funds us. Organisations show their value for the profession, I think, by investing in it. If your organisation isn't investing in you and your peers from the project and change profession, do question them around whether or not they're also investing in finance and the people profession and, the procurement profession and the estates and facilities profession. Because I talk to my counterparts in those associations, and most organisations do invest in those to provide their workforce with that support. And we need to create a level playing field and challenge where organisations say, we don't have the money for project and change, but we do for finance. That's not only not fair, it's not right, because actually we can only really deliver value if we collectively have the right skills and competencies to help deliver that change for the organisation. Thank you for joining me. If you have any other questions or you want to ask any questions, put your comments in the chat or send us a question to our mailbox and we'll follow up.